My name's Claire, I'm 28 and I'm in my second year of mental health. I suppose I've always had an interest in psychology, and then a couple of years ago I had some first-hand experience of mental illness. My brother went through quite a tough patch, and with the help of the psychiatric nurses he was able to turn his life around. I was inspired by the impact that trained professionals could make, and it made my job in HR seem really unfulfilling. I spoke to my brother's nurses and they told me about the mental health course at BCU. They told me it was a really great place to study and that it had a good reputation within the NHS. And so I went along to an open day and I was really impressed. I was a bit worried because I hadn't studied in a while and I didn't know if I had the right qualifications, but they told me about the Access to Health course that I could do at my local college. In the first year, you study alongside the general nursing students. A lot of mental health drugs can affect a patient physically, so you have to know the fundamental aspects of nursing. And then in the second year, you focus more on modules that look at the nurse's role, helping the patient through crisis and recovery. The course is nicely divided between time in placement and time at uni. In the first year you do something called the Self Project, which involves a series of simulations which allow you to experience what it might be like to have a mental illness. BCU was one of the first places to do this groundbreaking project. One simulation involved wearing headphones to recreate the feeling of having voices inside your head, and it really helped you understand how a patient might be feeling. And then all this work helps you build towards your placement. On the placement, you're working with patients day to day on a mental health ward. So you're putting into practice all the theory that you've learned, working with patients on a one-to-one basis, and just really getting experience of what the job will be like and what your role will involve. On one of my placements, I was assigned to look after a 16-year-old who had attempted suicide. And I think that when you're faced with the reality of some of the patient's situations, it can be quite difficult, but ultimately it's really rewarding when you feel you've made a difference to their well-being. So being 28 and having life experience really helps, I think. It's one thing putting into practice all the theory you've learned, but I think that having patience and understanding are equally as important. In third year, I'll be put on a management placement, which is basically learning how to manage a team on a ward, how to delegate roles within that team and make practical decisions. So you are treated as if you're qualified, but at the same time you have a strong support network of qualified nurses around you to support you. After the course, I would like to work in the community with people who, like my brother, have had distressing experiences, but that's not the only thing that you could do. You could go into inpatient care dealing with people who've been through distress and crisis, or you could work with children or the elderly, or you could go on to further study at BCU. But I think I'm quite looking forward to going out and having some real life experience.